So thank you very much for having me today. My name is Kelly Holman. I'm a Cherokee Nation citizen originally from Oklahoma. I enrolled tribal member. I was lucky enough to pursue my education. I have a PhD in health economics. I have done research on girls and women's empowerment in different countries around the world, including Liberia, Swaziland, South Africa, Tanzania, Mexico, Guatemala. But for the last 7 years or so, I have been really making an effort to come back home and look at what's happening in Native American communities here in the US. And so the IMAGEN project has grown out of my 25 years of international experience, plus my reading of tribal history, knowing what's going on now in Native communities, and realizing that there are some gaps here in our own backyards that could use filling and some expertise from the international community. So in Native American communities, there is quite a history of underinvestment by the US government, not upholding treaty promises that have been made over many centuries. And there's still actually punitive overregulation of communities. It's incredibly hard to open a business in a tribal community. Even things like housing is very limited. There are very strict rules as to how many people can live in one of these little tribal houses that are of very low quality. So there's a hidden epidemic, in fact, of homelessness in Native communities, a lot of couch surfing, and so really unstable situations for young people and dangerous for girls. You may have heard about the boarding school information coming out. My grandfather was in one of these boarding schools, experienced a lot of abuse. There's historical trauma that we carry on our shoulders in our DNA from centuries of basically exploitation by the government, structural violence, and that has led to poor health. Other epidemics that you may have heard about as well, missing and murdered people. And so Native communities are really looking for ways to heal and thrive in a more indigenous manner, reclaiming their cultural practices and heritage. This is a graph showing the percentage of Native children who live in a single parent household. And you can see that most people realize it's high among African Americans, but also a lot of people don't know that it's also very high among American Indian and Alaska Native children. The green bar on the left, over half live with a single parent. Most of these are mothers. And in fact, many do not live with either parent and live with a grandparent or an older sibling or an aunt or uncle. There's also a large rate of children being removed from their households and being fostered. So it's a chaotic environment because of the history of structural racism against these communities. But one thing also that people don't realize is that even within Native communities, girls and women have lower access to resources than Native men do. So you can see here, this is a survey that was done in 2017 on financial capability across the US, and this is the Native proportion of the data. And it shows that women in the red bars are much more likely to be financially fragile, have difficulty covering expenses. They're less likely to have non-retirement investments, much less likely to have high financial literacy. So you can see there's a lot to be done and that can be done in Native communities to even bridge that gender gap, much less the racial and historical gap that all Native American people experience. So we believe that support offered earlier could better serve girls in terms of preparing them for things they are likely to face, including taking care of a household themselves and a large extended family household in many cases. So girls can benefit, we've shown in our international studies, from supportive connections, socio-emotional skills, in the Native communities, cultural knowledge, knowing where they came from, who they are, education, health, training, access, as well as financial skills. And hopefully that will help them either avoid or cope better with some of the things you see in that chasm at the bottom there, that these things are unfortunately quite prevalent in Native communities. So the approach that we're taking in IMAGEN is, first of all, kind of a bigger picture scale. We want to look at principles that allow us to reach excluded girls. And we've shown across the world in the work I've done at the Population Council that these actually work. We want areas with high concentrations of the population that we're concerned about, Native Americans in this case, places with great economic and social need, and also we want to have a density of the program that we're doing within specific geographies, so there's a real demonstration effect of what is possible. So with IMAGEN, we began just a handful of years ago with thought and implementation partners from Native American communities, from NGOs around the country, people in health, education, justice sector. We have a Native female advisory group. We issued a call for community partners where we spread it around many, many listservs and organizations across Indian country, as we say. And we vetted these applications. We had some funding to cover some staff time. We have MOUs. We started with an in-person training among these partners, and we have monthly supportive gatherings that we started doing at the beginning of COVID, and those have continued, and we've found them quite useful. So the partners in our first phase of this work that we're just coming to an end to now, and we're about to start phase 2, they include the ones on the map here. This map shows the percentage of population that is American Indian by county in the US, and you can see the dark blue and purple areas are where Native Americans are found mostly, and we're working in some of those areas. We didn't have funding to go to the Southwest. We hope to in our next round, but we're working with an urban Indian clinic in Oklahoma, and we're working with a number of partners in South Dakota, Thunder Valley Community Development, 100 Horses Society, White Buffalo Calf Women's Society, as well as the Mille Lacs Band of Ojibwe in Minnesota. Each of them has a different core remit, whether it's health, violence prevention, community development, but they all realize the importance of reaching girls earlier, in particular excluded girls who may not be living with a parent or even a grandparent. So the mechanism that we use to reach girls in communities that we have used for a couple decades now in international settings, and in the Native American community, it's similar, but we call it the Girl Society because Native communities historically have had societies to accomplish things, an agricultural society, a warrior society, and so this is a Girl Society. It's a community-based girls group. Same girls, same mentors meet weekly over a course of several months, same time, same place, every week. So it's reliable. In the Native setting, we use a young woman paired with an elder woman. The elder is the knowledge keeper and can really tell girls about their tribal history, about customs that their tribe use, coming of age ceremonies, different things that they need to know in terms of who they are as Native people. What does success look like? We want to have a density of female leadership within tribal communities. We want to reknit that social fabric that has been damaged by US government policies to destroy Native culture. We want to see changes in community attitudes and more attention to girls' issues. Women are sacred in Native communities, but girls really are not getting the investments that they should and that are warranted. We want to increase the livelihood skills and activities among the adult women who are working with our girls. We want girls themselves to have greater skills, social capital, human assets. And we would also, we're working on training a cadre of Native female data fellows who can maintain a strategic information database about what we're doing in this program. During COVID-19, like everyone else, we had to shift to really doing a lot online with the girls. Mentors convene virtual groups to do different sorts of activities, including beading and sewing, making masks, making ceremonial objects, cooking, each person in their own kitchen, cooking, Native healing circles, prayer, self-defense classes, and then one-on-one support between mentors and girls. We were fortunate to have a donor that was able to give us funding so that mentors could have extra supplies for girls during COVID, food boxes, PPE, diapers and baby wipes for teen mothers, feminine hygiene, different spiritual supplies, sweetgrass, sage, different things that are needed for healing ceremonies, social and emotional wellness kits, as well as mobile phone and data plans. As you may know, connectivity is a real challenge. You know, in many sub-Saharan African countries, people are, you know, been doing mobile money for decades now, but there's still a lot of basically bare spots in terms of cell coverage in Native communities, and virtually no one has broadband. So it's really not a well-connected community when it comes to those infrastructure pieces. So the volunteer opportunities we have in IMAGEN, I need to compile a set of tribal origin stories. There are more than 600 Native tribes in the US, and many of them don't know their origin stories because they've been lost. Some of them are written down, so I'm working on compiling those, but with the hundreds that are available, I need some help with that. Strategic information tool development. We have some tools that we use for electronic attendance, basically trying to monitor and evaluate the groups. So we could use some help with that. Data curation and analysis. We have some data analysis and some reports that we'd like to write that we could use some help with. Website, we need to do some refreshing, fundraising, and we want to have an in-person event probably in the fall or winter, and we're looking for some planning help with that, and possibly in-person attendance at that event, but that would happen later this year, and we haven't set the date yet. So if you want to find out more, there's a documentary about our work with the Lakota communities. It's called The Lakota Daughters. You can see the YouTube links there. It's 33 minutes. We have a 90-second preview, and we have various film panels and Q&As we've done. It's won awards at different film festivals, including a Gracie Award. If you want to stay in touch with us, this is our email, our website. There's a newsletter you can sign up for. We're somewhat on social media. I wouldn't say it's great. Our website is probably the best place to go. So thank you very much. Really enjoyed sharing our project information with you.